Hello, I'm Dr. Flores. I'm one of the fertility specialists here at San Diego Fertility Center. And today I wanted to talk about endometriosis, what it is, how we think people get women get endometriosis, and then how can it impact fertility. So endometriosis is defined as endometrial-like tissue outside of the uterus. And the most commonly accepted theory is that even though when a woman has a menstrual cycle, the blood is supposed to go out through the vagina, sometimes that blood refluxes through the fallopian tubes and can implant on different areas of the pelvis. And because it's tissue like the lining of the uterus, just like the lining of the uterus grows and sheds each month, the same thing can happen to the tissue in the pelvis, except that there's no place for it to go. So it can cause a lot of pain and a lot of inflammation over time. The diagnosis can be challenging because not everyone has the same symptoms. Some women present with progressively worsening pelvic pain. Some women have no symptoms, but the one symptom that they do present with is infertility. And we know actually that with endometriosis, with that diagnosis, up to 50% of women can also have infertility. Now, I don't say that to scare you. I say that so that you can know that really where we come into play then is if the diagnosis has been made, really seeking out an appointment early on in your fertility journey is key. And that's because we know that women with endometriosis can have a little bit of a harder time conceiving. And so our goal to help with that is to really minimize the time to pregnancy. And that's for a couple of reasons. One, we want you to rest assured that you'll be able to complete your family and the size that you desire. And then on top of that, because each time that pregnancy doesn't happen, there can be a flare of that pain, we really want to shorten the time to pregnancy as well for you. So we have a couple of different treatment options, and they're really aimed at targeting the various aspects of endometriosis. As I mentioned before, that tissue in the pelvis can cause a lot of inflammation and ultimately scarring as well. And so when we think about how endometriosis can affect fertility, it can affect it from various aspects. One, it can affect the egg quality from the perspective of the inflammation in the pelvis. Two, it can affect the transport of the egg through the fallopian tube. It may also affect the transport of the sperm as they travel through the uterus into the fallopian tube to meet with the egg. And in more severe cases of endometriosis, there can be scarring such that it can be a little bit harder for the egg or the sperm to actually travel through the fallopian tube if there's some damage or some scarring around the fallopian tube. Another way that endometriosis can contribute to infertility is really looking at what is allowing the endometriosis to grow and what should normally decrease growth of the endometriosis. So endometriosis grows in response to estrogen. Estrogen naturally will increase in the body as an egg is developing, and after that egg ovulates, the hormone that comes on board now or is more prominent is progesterone. Progesterone is normally supposed to help lead to shrinkage of the endometriosis. Essentially, the endometriosis should stop growing with progesterone exposure. Now, people have done studies looking at what's the progesterone level in someone with endometriosis and someone without endometriosis, and it's actually the same. It's just that for some reason, the endometriosis tissue doesn't respond to an individual's own natural progesterone. And so how we can treat that, if individuals are presenting with pain, we treat that first line by giving extra progesterone in the form of a progesterone-only pill or a birth control pill. In patients who are seeking fertility, it's a little bit different because a lot of the treatments that we have for endometriosis, pain-related endometriosis, are in some ways birth control, so it limits ovulation. But really why I bring that up is because just like the endometriosis tissue can become non-responsive to your own natural progesterone, which we call progesterone resistance, the same thing can happen to the lining of the uterus. And progesterone, again, is very important to prepare the lining for implantation and ultimately to help the pregnancy continue to progress. And so when we're talking about the different fertility treatment options, they all do involve in some ways giving you additional progesterone to overcome any potential progesterone resistance at the level of the lining of the uterus. So first line treatment, which we typically reserve for patients with early stage disease, would be something called ovulation stimulation and intrauterine insemination. So that involves giving an oral medication called clomiphene citrate. What that medication is doing is it's tricking the brain into thinking that your estrogen levels are low, and in that way really gets the brain to work a little bit harder to get the ovary to make, instead of just one egg that month, potentially 2 eggs that month. We also combine that with an intrauterine insemination. So that's again bringing the sperm closer to the egg, so directly into the uterus, and then from there it can hopefully have an easier time meeting up with the egg in the fallopian tube. And the one thing that we do a little bit differently for patients with endometriosis is after the 2 days after the insemination, we will also supplement you with vaginal progesterone. And that's because we're trying to help overcome that progesterone resistance so that we can have proper implantation and hopefully have the pregnancy continue to progress. Now, sometimes ovulation stimulation and intrauterine insemination is not successful. And that is not a reason to be alarmed. We usually recommend up to 4 cycles before saying that, you know what, maybe it's now time to move on to another form of treatment, which would be in vitro fertilization. There are also some patients with endometriosis where actually in vitro fertilization may be first line. And that's in particular for women with more advanced stages of disease where we're worried again about any potential scarring that may be affecting the ability of the fallopian tube to be functional to allow the egg and the sperm to meet. But in vitro fertilization is really a key treatment for patients with endometriosis because it really targets all aspects of how endometriosis is affecting fertility. Remember, I mentioned that inflammatory environment in the pelvis may not be good for the egg. And so one way that IVF helps is that we retrieve the eggs. So we remove them from that inflammatory environment. And then in our embryology lab, we'll then combine your eggs with either a partner sperm if you are in a heterosexual relationship or with donor sperm. And then we watch the embryos develop. We can also do genetic testing of the embryos. But ultimately, once it comes time to the embryo transfer, again, we'll modify things to help optimize the likelihood of success, knowing that you have endometriosis. And what I mean by that is there are a variety of ways to do an embryo transfer. One type is called a natural embryo transfer, which, similar to what it sounds like, we essentially watch as you get your own follicle to grow or your own egg to develop. We'll trigger ovulation, and then a week later we do an embryo transfer. Another option, it's called controlled ovarian hyperstimulation frozen embryo transfer, where we almost do like a mini IVF. So we do give you injectable hormones to get you to grow around 2 to 3 eggs, again triggering ovulation and doing an embryo transfer a week later. However, the concern for patients with endometriosis for why that may not be the best treatment option is, again, if we know that there can be some level of progesterone resistance at the level of the uterus, and if we know that many times patients with endometriosis, their own natural progesterone they're not responding to, then the natural embryo transfer cycle doesn't really target giving you that additional progesterone that you may need. And so really what is the more preferred option is doing a frozen embryo transfer cycle that we call a medicated cycle, where not only are we essentially kind of taking over your menstrual cycle by giving you estrogen either in the form of orally, through patches, or as a vaginal suppository, but we also give you supplemental progesterone in the form of an intramuscular injection. So again, with the goal being that we're going to overcome that progesterone resistance. So these are just some of the ways that will work with you to really individualize the care, knowing that endometriosis can affect fertility. But again, the end goal is to help in terms of you completing your family, and so there definitely are ways, even though we know that endometriosis can contribute to infertility.